Good day, everyone. I'm Dr. Ayla Esmerjan Sui de Torres, and for today, we will discuss about malaria. And for the objectives, first, to define malaria and how is it transmitted. Second, to discuss the global and local burden of malaria. Third, to recognize the signs and symptoms of malaria. Fourth, to diagnose malaria and its management. Fifth, to discuss the National Strategic Plan to control and eliminate malaria. So, what is malaria? A quick history on malaria. It came from the Italian word malaria because earlier theories suggested that this was caused by bad air. It was also known as marsh disease, because most of the people infected resides in marshlands. However, following the discoveries of Louis Pasteur that most infectious diseases are caused by microbial germs, the hypothesis of a bacterial origin of malaria became increasingly attractive. So a French doctor named Alphonse Laveran in November 6, 1880, discovered malaria. He said he saw on the edges of a pigmented spherical body filiform elements which move with great vivacity, displacing the neighboring red cells. With this discovery, he sent two notes to the Academy of Medicine on this new parasite found in the blood of several patients suffering from marsh fever. The illustration on the right, drawn by Laveran, of various stages of malarial parasites as seen on fresh blood. Malaria is a life-threatening disease spread to humans by mosquitoes of genus Anopheles. It is mostly found in tropical countries. The infection is caused by a parasite and does not spread from person to person. Symptoms can range from mild to life-threatening, but luckily for us, malaria can be prevented by avoiding mosquito bites and medicines which can stop mild cases from getting worse. Now, let's go to the life cycle of the parasite. Okay, the human malaria occurs by transmission of the Plasmodium sporozoites via a bite from an infected female Anopheles mosquito. These sporozoites travel to the liver of the host and invade the hepatocytes. These cells divide until mature schizons are formed, and each containing thousands of daughter merozoites. The liver schizons or the hepatic schizon then rupture and release thousands of merozoites, and that will eventually invade the RBC or the red blood cells. And then within the red blood cells, parasites digest the hemoglobin and then reduce cell membrane deformability, resulting in hemolysis, accelerated splenic clearance, and then which all may lead to anemia. Merozoites continue the sexual cycle and infect the new RBC, although a few differentiate into male and female gametocytes. And once these gametocytes become mature, they circulate in the bloodstream until they are ingested by a blood-feeding female Anopheles mosquito. And these are the vectors of malaria. We have the Anopheles littoralis, maculatus, mangianus, and balabacensis. And after discussing what malaria is, how is it transmitted, and the life cycle of the parasite, let's now discuss the global data on malaria. So according to WHO, the World Malaria Report 2022, there are estimated 247 million malaria cases in 84 malaria endemic countries last 2021. And according to this, Philippines is one of the many countries who still have at least one indigenous cases. And this figure shows the global trends in malaria case incidence. And according to WHO, malaria incidence declined from 82.3 per thousand population at risk in 2000 to 57.2 in 2019 before increasing by 4% to 59.2 in 2021. And these results suggest that efforts by countries and partners averted the worst case scenario projected as the start of the pandemic. And for the malarial deaths, since 2000, there was a steady decline from 897,000 to 568,000 in 2019, from 30.1 per 100,000 population at risk to 14. And in 2021, it was 14.8 per 100,000 population at risk. Between 2019 and 2021, there was a difference of around 63,000 deaths that were due to disruptions to essential malaria services during the COVID-19 pandemic. I am sure not only did the malaria experience disruption of services, no, it is also true for other diseases in the community. Okay, so how about in the Western Pacific region? So the figure on the left shows the malaria cases decreased by 49%, according to WHO, from 2.8 million cases in 2000 to an estimated 1.4 million cases in 2021. In the period 2000 to 2021, malaria cases incident reduced from 4.3 to 1.9 case per 1,000 population at risk. On the other hand, the right also shows that malaria deaths decreased significantly by 58% from about 6,200 deaths in 2000 to 2,600 in 2021. It is also noted in the figure that there has been an increase in cases and deaths between 2019 and 2020, and probably due to the increase in Papua New Guinea, the malaria mortality rate are also reduced from zero point 0.9 to zero point 0.3 deaths per 100,000 population at risk. So this next figure shows that Papua New Guinea accounted for 87% of all cases in the Western Pacific region in 2021, followed by the Solomon Islands, Cambodia, and the Philippines. Four countries have fewer than 10,000 estimated cases in 2021. China was a certified malaria-free in 2021, while Malaysia had no cases for 4 consecutive years. Hopefully, the Philippines will also achieve this. And after knowing the global data, let us now look on how we doing locally. So, comparing the global data, malaria cases in the Philippines also decreased from more than 100,000 cases per year in the 1980s, so to the present annual figure of around 5,000. It was also noted in the figure that there is also an increase in the number of malaria-free provinces, and in fact, in 2019, indigenous malaria cases has been reported for only 3 out of the country's 81 provinces. So, namely, we have the Palawan, Sultan Kudarat, and Mindoro Occidental. So aside from the decreased cases, it can also be seen in this figure that there was also a decrease malaria death from almost 50,000 in 2003 to around 4,000 in 2019. So the remaining malaria foci in the country outside Palawan have now been eliminated or are close to being eliminated, as like this figure shows. Only Palawan is still under the control phase. Actually, the number of provinces reporting zero malaria cases has increased from 71 in 2016 to 78 in 2019, and the number of provinces declared malaria-free increased from 36 to 50. Now, let us discuss the signs and symptoms of malaria. So, as a review, malaria is a parasitic disease that reproduces in mosquitoes, inside human RBC, and in the liver cells. So, this parasite is transmitted by the female Anopheles mosquito. After invading the RBC, it bursts and releases substances that induce chills, fever, and sweating. And then patient may experience various symptoms. The classic paroxysm begins with the cold stage. This is when the patient experiences the intense cold, shivering, and chills. This lasts for around 1 hour. Then comes the hot stage, where intense heat is experienced. So patient feels dry, burning of the skin with associated throbbing headache, and can last up to 6 hours. And finally, the sweating stage, where the patient will have profuse bleeding and the body temperature drops to normal or below normal. The patient may also feel exhausted and weak, and this stage may last from 2 to 4 hours. And currently, there are four species of human malaria. These are the Plasmodium falciparum, Plasmodium vivax, Malariae, and Ovale. So, Plasmodium falciparum comprises of 70% of all malaria cases in the country, and it is responsible for the severe or complicated malaria causing mortality. The vivax or the Plasmodium vivax comprise around 30% of the remaining cases in the country. So how do we diagnose malaria? It always starts with with a good history and physical examination. And a patient suspecting of malaria must be asked if he or she traveled to a place with high malaria cases. Although physical examination is usually unremarkable for malaria, but splenomegaly may be present. And to confirm our diagnosis, we do blood smears uh, using the tick, no? And the thin films. So thick smears should be stained by GEMSA or the field stain, while thin film should be stained by the GEMSA or Leishman stain. We can also use rapid diagnostic test, which can detect and have a result for 15 to 20 minutes. So, busy slides, but this slide shows the available anti-malaria drugs in the country. So, on the table to your right, you can see the different treatment regimen, no? For the different species of Plasmodium. If you will notice, on all the treatment regimen contains the artemether lumefantrine, otherwise known as the artemisinin combination therapy, which is what is also recommended by the WHO. For those of you who plans to travel to Palawan, especially if you will stay in the mountains, it is recommended that you do prophylaxis. So for travelers, we can take doxycycline 100 milligrams tablet daily for 2 to 3 days before going to an endemic area like Palawan. Continue while in that area and for 4 weeks after leaving. So in that area and then 4 weeks after leaving. On the other hand, for pregnant women, we can residing in the stable transmission area, it is also recommended to take the sulfadoxine or the pyrimetazine. Um, you should take 3 tablets each in second and third trimester as prophylaxis. And now, for the last part of our lecture, let us discuss the National Strategic Plan for the Control and Elimination of Malaria in the Philippines. So its vision is a malaria-free Philippines by 2030. So that is very near. No? So by 2022, last year, malaria transmission will have been interrupted in all provinces except Palawan. 75 provinces will have been declared malaria-free, and the number of indigenous malaria cases will be reduced to less than 1,200, or by at least 75% relative to 2018. So one of the ways to achieve the goal is, of course, prevention of the establishment of malaria in malaria-free area. So to do this, we should promote the prophylaxis. Every traveler should be aware of this and be prepared before they travel to an endemic area. Next is early detection of any malaria infection in a person entering malaria-free area. This is done by screening, of course, and or by educating for appropriate health-seeking behavior. Third is the rapid diagnosis, treatment, and reporting of cases at primary level of care. The provincial elimination hub should work with each province primary healthcare provider network to ensure that all primary care providers recognize suspected malaria, know where to obtain the diagnosis and treatment, and, of course, most importantly, we should report it immediately. And lastly, especially if an imported case is found, conduct a case and focus investigation. So as what I have said a while ago, oral ACT, no, plus a single dose of Primaquine remains the standard first-line treatment for Plasmodium falciparum. Okay? And ACT plus 14 days of Primaquine for as first-line treatment for Vivax, Plasmodium vivax. However, for those patients taking Primaquine for 14 days, they should be monitored for dark urine, so adverse drug reaction, no, by the field assistants. Also, as part of the case management, the rapid diagnostic tools in the high-burden municipalities of Palawan is also important. So next are the halfway houses. So these are built to supervise the treatment of patients, no, for 3 days for Plasmodium falciparum and 14 days for Vivax. So this will also ensure that follow-up can be offered to all patients in the three most highly endemic municipalities, namely the Bataraza, the Brooks Point, and Rizal. To motivate them, so free meals are provided for them and one accompanying person. Currently, there are 11 halfway houses available. So next is the long-lasting insecticidal nets, the LLIN. So to improve the LLIN utilization, so the distribution will no longer to central barangay distribution points, no? But house to house, no, with recording of numbers of different types of nets received by each household. So aside from distribution, volunteers can do face-to-face education, including helping the families to hang the nets, then providing tools, nails, and trying material. So, appropriate sizes and numbers of LLINs, or the long-lasting insecticidal nets, according to the DOH protocols, will be procured and distributed at a community ratio of one family-sized net per two household members in each household. So, or for single nets, the norm will be distribution of three per household. So, one family size net to two household members, then three single nets per household. That is the ratio. Okay. The next is the IRS, or the indoor residual spraying. WIRS, no? done in Palawan from 2016 to 2019. No, uses 3 rounds of pyrethroid insecticide. Okay. However, the WHO recommended that insecticide used for IRS should always be with a non-pyrethroid insecticide to prevent resistance. Okay, so this was a problem because in 2019, because of the detection of pyrethroid resistance in Palawan. So an alternative to this insecticide would be a long-acting organophosphate, primefosmethyl, which only needs to be sprayed once a year. Okay. So lastly, but certainly not the last, no, not lastly, but certainly not the least, no, it is the education of the community. Focus on the prevention of its transmission. We have the World Malaria Day celebrated during every April 25, and doing infographics, sharing from the DOH to fight against, or to end malaria in the Philippines. So in summary, we have discussed the natural history of malaria, the global and Philippine burden of malaria, and the DOH program in malaria. And with that, thank you for your kind attention.